she's got some heart rot. Come on over and we'll fix it.
All right. I want to get well.
Okay, everyone, my name's Anna, and I'm also a nursing student at BYU, Idaho, along with all of these awesome people who just talked to you guys. And I'm going to be talking about vaccines or immunizations, which I heard that a group a couple of months ago did talk about this, so I hope I can kind of enlighten you guys a little bit more, give you some more information about it. But first, can you guys hear me all right? Hear me? A little louder? Okay, perfect. So then I just have a quick question. How many of you guys received your flu vaccine this past year? Oh, awesome. I like to see that. I'm an immunization nurse, so I'm the one that gives all those flu shots. Just in this past year, the Center for Disease Control and Prevention produced a study that found that over 60% of seasonal flu-related hospital stays occurred with those that were 65 years of age and older. So thus we can understand that as we get older, our immune system decreases and how efficiently it works, and thus we are affected more by the diseases that can come around. And so we can understand why vaccines are so important. So on the board, I kind of described 4 different vaccines that are commonly given around this age group and that are so important. So the first is the seasonal flu shot, which I'm glad to see that all you guys are getting those. It's a very contagious respiratory illness with muscle aches, coughs, fevers, chills that you guys probably understand very well because of how much it goes around. And in recent seasons, 80 to 90% of flu-related deaths have occurred with those 65 and older. So you can kind of put the 2 statistics together and see what a large number of people are affected by just the seasonal flu. So you can receive the seasonal vaccine every year. The peak season is around January, so you want to get your flu shot around October or November in order to prepare for that season. So the second vaccine is the Tdap. So it's 3-in-1. So it covers 3 diseases, but it's 1 vaccine. So it involves tetanus. So it's a serious bacterial disease that affects your nervous system. You guys probably know by stepping on a nail that's rusty, you think of tetanus. And it causes really bad muscle contractions that can affect your breathing. And then diphtheria, which is a bacterial illness that affects your mucous membranes, making it really difficult to breathe and things like that. And then whooping cough. Did any of your children have whooping cough? You had it? So it's pretty scary. So this is the vaccine that covers that as well. And you want to receive the Tdap every 10 years at least, but some places may require it to be given more often. Or if you're visiting great-grandchildren, grandchildren that are pretty young, you want to get this to protect them from getting the whooping cough. And then the third vaccine is the shingles. Yeah, I heard some moans. Those are not fun in any way, shape, or form. It's a very painful rash that follows just a nerve. And the actual rash can be there for just a number of weeks, but the pain with it can last months or years. And so even if you have had shingles, the vaccine can prevent that breakthrough pain and then the reoccurrence of the disease again. So you want to normally get that vaccine around 60 years or above. And so the fourth vaccine is the pneumococcal vaccine, which, what does that sound like? The pneumococcal. Makes you think of pneumonia.
Oh, okay.
Okay, so that's what it commonly causes, but can also cause blood infections or even meningitis. But the Centers for Disease Control and Prevention also found that the pneumococcal disease causes more than 1 million cases of pneumonia every year. And death rates are 5 to 7% and even higher for those 65 and older. So thus we can understand how important that vaccine is too. So you normally receive that around when you're 65, but if you're immunocompromised or if you have certain disorders, it can be given at an earlier time. So just in conclusion for the vaccine portion, they're incredibly important because they protect your cells and they protect other people from contracting those diseases. And something that may be, like the flu may not be harmful to someone my age, but with very young children, as one ages, it has a greater and more debilitating effect. So remember, always discuss your, you have a question?
Pneumonia shot more than once?
Yeah. Yeah, it's perfect. She knows exactly.
Every 10 years?
Mm-hmm. Which, if you are immunocompromised or have certain other things, they can give it sooner than that. So, yeah, so the big thing with vaccines is discussing with your healthcare provider, your doctor, because they understand your history, your situation, your medications, diagnoses way more than I do. So they can let you know when specifically you need to receive that vaccine. So that's just an important thing to kind of remember. And also, some clinics may not offer the vaccines at their site, but will give you an order to get them at a pharmacy or some other resource. So just generally for our group, we just want to say thank you for letting us come and visit with you guys, give you some information.